Completing ABC forms. The Alabama Breast and Cervical Cancer Early Detection Program, commonly referred to as ABC, involves paperwork. The ABC forms are a critical part that keeps the program running. Although it can be a challenge, it's necessary. Things go smoothly when forms are filled out completely and submitted timely. Let's take a few minutes to review the forms used within the ABC program. All forms are available to print out on our website. Eligible participants are enrolled in a web-based system called MedIT. Enrollment includes checking eligibility criteria and entering demographic and appointment information. An appointment information page is generated and includes unique MedIT tracking numbers. The tracking number must be added to the upper right-hand corner of all ABC forms pertaining to the patient's care. This tracking number identifies a patient's particular episode of care. This information is important as the tracking number is key to clinic payment. If a patient returns to the clinic a year later to be rescreened, she must be re-enrolled, sign a new consent form, and be assigned a new tracking number. As previously discussed, the tracking number is obtained when the patient is enrolled in MedIT. The form may be printed. Once enrolled, participants will complete the first form, the ABC Informed Consent. The form includes a declaration of consent, provides the program description, and must be signed and dated by the patient. By signing, the patient agrees that the clinic can share her information with ABC and other providers completing her care as needed. The signed and dated informed consent form should be placed in the patient's medical record. The second form is the screening form. This form is completed by the medical provider. It serves as a summary of the visit. It identifies what happened during the visit and identifies what tests were ordered. The tracking number needs to be placed in the upper right corner. The top portion of the form includes name, date of birth, address, phone number, and social security number. While the social security number is not required, please make every effort to include it. In the event that a patient's social security number is unknown or the patient does not have a social security number, leave this entry blank. The patient's race, ethnicity, smoking status, annual income, and household size are also collected in this section so that ABC can learn more about the women and show the CDC, its funder, who the program helps. Without this information, the form will be returned to the clinic and payment for services will be delayed. The second section of the form is the breast screening section. The date and result of the CBE, the type of mammogram ordered, and the patient's breast cancer risk assessment score are documented here. The third section of this form is the cervical screening section. It collects the patient's previous pap smear date, patient history regarding bilateral tubal ligation or hysterectomy, indication for pap test, the pelvic exam result, the patient's risk for cervical cancer, indication for HPV testing, and the PAP and HPV test results. The results of the PAP and HPV test are placed in this section once the results are received back from the lab. The bottom of the cervical section is used to indicate repeat co-testing or to refer a patient for further diagnostic testing. While ABC covers a PAP HPV co-testing every 3 or 5 years, the program will cover more frequent testing for women who have had abnormal results as recommended by ASCCP guidelines. In general, at least one of the listed services must have been provided and fully documented to receive payment for the office visit. This means either a clinical breast exam and/or a pelvic exam with PAP have been performed. The screening form and health insurance form, the 1500, should be forwarded to the ABC Regional Coordinator for approval. Once approved, the form will be processed for payment. The third form is the ABC Mammogram Voucher. It is generated when a patient is being sent for a mammogram. It should be sent with the patient to the mammogram facility and can also be faxed if needed to the facility. Like the previous forms, the tracking number must be placed in the upper right corner. The form is divided into two columns. The first column should be completed by the provider ordering the mammogram. The top section of the first column includes date of birth, address, social security number, ethnicity, and race. The next section includes the date of the patient's prior mammogram, any breast symptoms the patient may be experiencing, date the patient is referred for mammogram, or date of CBE, result of CBE, the patient's breast cancer risk assessment score, the type of mammogram ordered, and ultrasound if indicated. The referring provider name and address should always be included at the bottom of this column. The ordering provider should also enter the name of the mammogram facility and appointment date and time at the top of the second column. The rest of the second column should be completed by the mammogram facility. It contains the date the mammogram is completed and the results of the mammogram. The bottom portion of this column is used when additional imaging is needed based on CBE and/or the screening mammogram. The results of additional diagnostic mammogram views, ultrasound, the final imaging outcome, and recommendations should all be entered. The mammogram voucher, mammogram and ultrasound report, and the health insurance claim form, the 1500, should be sent to the ABC Regional Coordinator for approval. Once approved, the form will be processed for payment. In some situations, a breast MRI may be recommended. In these rare situations, the breast MRI authorization form is required. The ABC program will only cover screening breast MRIs for women who meet specific high-risk criteria. All breast MRIs must have prior authorization signed by the ABC Regional Coordinator. The tracking number should be placed in the upper right corner of the form. The top portion of the form should be completed by the ordering provider by entering the patient's information with their name, date of birth, social security number, phone number, and the provider's name, date of referral, name of referral hospital, and provider phone number. Section 1 should also be completed by the ordering provider, indicating the eligibility factor that qualifies the patient for the screening breast MRI. In Section 2, the provider indicates the type of MRI that is being ordered. The form is then sent to the Regional Coordinator for authorization, Section 3. Once authorization is completed, the fourth and final section should be completed by the facility performing the MRI. This section is where the results of the MRI are recorded. The completed breast MRI authorization form, MRI report, and the health insurance claim form, the 1500, should be forwarded to the ABC Regional Coordinator for approval. Once approved, the form will be processed for payment. That's the paperwork process, and as you can see, details really do matter. It is important that the paperwork is completed correctly to reflect the care you provided to the women that we serve. Just as it is important to provide care timely, ABC wants to ensure we can promptly pay providers. Incomplete or missing documentation delays payment. So take one more look and ask a few questions. Has the patient provided the necessary information? Has she signed the consent form? Does she meet the ABC eligibility requirements? Are the Pap and/or biopsy results entered? Are the mammogram results noted on the voucher? Is the tracking number in the upper right corner of all documents? Does the billing office know to bill ABC? Are the CPT codes listed on the health insurance claim form, the 1500, approved by ABC? If yes, then you're good to go. Just fax, email, or mail the forms to the ABC regional coordinator in your area and you're done. That's it. You've mastered the paperwork. Thank you for providing breast and cervical cancer screenings for women in Alabama enrolled in the ABC program. All ABC forms are available to print at alabamapublichealth.gov.